I see a lot of faces joining us this morning. Well, I see a lot of names joining us. If you want your faces to join us, we'd love that too. It's always happy to have a panel to view when presenting. It's nice to see you all. We're happy to have you back for our Washington State RNR webinar series. My name is Colleen Gibbons. I've had the opportunity to chat with a bunch of you at different points in time throughout this series. Today, we do have a new speaker with us. His name is Fred Butcher. You will see him, and you may also see my cat who is climbing up my back this morning. It's lovely to be here. Fred is going to speak with us this morning. His title of the presentation is Risk, Needs, and Responsivity Tools, Development and Research Evidence. Fred is a researcher who has been to Washington State to present on RNR before. I heard him speak and, excuse me, kitten. I heard him speak and learned quite a bit and was happy to be able to invite him here today to speak with us about the tools that he is very familiar with. So we're happy to have him here. I'm going to let him introduce his background and go right ahead with his presentation. Fred, take it away.
Hi, all. Let me try to share this. Okay. I got to kind of look over here, so sorry if my head's kind of turned the entire time, but that is just my setup. So my name's Fred Butcher. I am a principal that doesn't look right, does it? Sorry. Does that look better on your end?
We see the internal slideshow. I've been having a problem with that in sharing my slides lately too. I don't know why or how that happens.
Okay. Well, I don't really keep any notes, so I guess it's fine. So my name's Fred Butcher. I'm a principal research associate at the Center for Justice Innovation. And prior to coming here, I was with Case Western Reserve University. I was a research assistant professor there. And mostly my work kind of primarily revolved around looking at diversion programs on the youth side. But I got really interested in psychometrics and kind of understanding how to measure things in the social sciences, and particularly for youth who are justice system involved. So kind of understanding, how do you measure their needs? How do you measure risk? And how do you make decisions based on that? So today we're going to talk about, kind of give you a brief overview of RNR theory, and really kind of go back and talk about what scales are and how are they developed, and kind of how do we get to these risk assessments and measurements. Overview of psychometric properties of scales and why they matter. Now that's a big word, but I'll kind of talk you through exactly what that means, the psychometric properties of scales, and why that matters to anybody using these tools. What are some of the gaps in the research on RNR tools? And then finally, racial disparity around risk tools. Okay. So RNR theory. The three principles are guiding RNR theory. There's a risk principle. The idea is that you have to match the level of service to the offender's risk to reoffend. And this is where kind of the assessment of criminogenic risk comes in, and where you kind of match the level of treatment and the intensity of treatment with the criminogenic risk. Now, I will say that intensity of treatment is a very difficult thing to define and to really kind of wrap your head around. I know on the youth side, we used to have programs that were defined by some of the folks who created these tools as intensive. And I'd ask treatment providers, do you really consider this intensive? And they're like, nah, not really, you know. And so there was a lot of debate about exactly what that means. And I think it's important too to kind of understand where R&R theory comes from, that it comes from folks who developed CBT programs. And so they're very CBT focused in terms of how R&R works and how risk assessments apply. And also the things that are measured in typical R&R assessments. Need principle. So you want to assess criminogenic needs and target them in treatment. The idea here is that there are behavioral health needs and generally needs that folks have that may be criminogenic. Things like, you know, housing insecurity or economic issues or things like that that may be at the root cause of reoffending. And you want to target them in programming and target them in treatment. And then finally, the responsivity principle. And this is the principle that I think most R&R tools do kind of not a great job at, is measuring responsivity. The idea is to tailor intervention to learning styles, culture, and strengths of the individual. So you want to tailor intervention to a place where it's most effective, right? That people respond to that theory or to the treatment. Okay, and where we're at is that we use essentially third generation tools. Now there's a fourth generation too, but most of the tools you use, the ORAS and the CCAT are both third generation tools. So I'll kind of focus on those. The idea here is that they incorporate both static and dynamic factors. Static factors are things that can't change. They're static. So, you know, you're talking about things like criminal history, past substance use. Those things you can't change through treatment or can't really address. Dynamic risk are things that can change. So, for example, your current employment status, that might be something that you can address through programming. Those are factors that change. Those are factors that can change from the time you give the assessment to, you know, the time that treatment starts. Right. Okay. So a little bit about latent and observed variables. Now, there are times where I need my child to kind of do something constructive on her iPad. And so I made her draw something. So it kind of, but it makes sense. So latent versus observed variables. Let's pretend that I am a Kraft mac and cheese salesman. And basically I'm on a boat trying to find an island that does not know anything about Kraft mac and cheese. So we're trying to find new markets.
Fred, can I briefly interrupt? Can I try to share so that way we could use the full screen?
Sure.
I can do that. I'm going to try. I pulled it up in my browser, which might work differently. Okay. So let's see. Does that work? Can people see the full?
Yep.
Okay. Just let me know when you need me to switch, Fred. Sorry, I know that's annoying, but that way we can.
No, that's perfect.
It's great.
Much better. Okay, so because I'm in this new market, I can't really measure how likely it is that you'll buy Kraft mac and cheese because, well, there is no Kraft mac and cheese, right? So that's what we might call a latent variable. It's something that we can't observe and something that we can't measure directly. So how we get at that, and this is how we get at criminogenic risk, right? You can't directly measure criminogenic risk. what you do is you measure the things that you can observe, the things that you can actually directly measure. So I might get around this problem by asking things like, do you like pasta? Do you like cheese? And saving time by not having to cook things from scratch is important. And then saving money on food is important, right? And all of these things kind of get at why somebody might be motivated to buy Kraft mac and cheese and make a box of mac and cheese. Okay? So really, that's what we're ultimately measuring, is the likelihood of somebody going to the store and buying that box of mac and cheese. And we're measuring that through the things that we can see directly. Okay, next slide, please. Okay, so the next picture is my wife's a math teacher, and we were, and I told my daughter, I said, yeah, this is a slides about math. And she said, okay, I got the picture. So she drew mommy teaching math. So that's what that is. Scale development. There's a lot of math that if you can imagine, that goes into developing some of these scales and some of these measurement tools. And at the beginning, when you try to, when you think, okay, I want to create a new, how I would do that is by creating items, right? So thinking up all of the questions that I might ask to get at this question of risk for recidivism. And so that item creation will involve like literature reviews, thinking through exactly what the theory is, and really kind of looking at like all of the entire universe of questions that I might want to ask that gets at the question of whether somebody is likely to reoffend. And then you usually involve experts around this, right? So folks that are working in the system. I might talk to judges, to attorneys, to treatment providers, to like all of the folks who would be interested in using this. I would ask questions around, what are the things that you see in your clients, and then what I would do is, using math, I would reduce some of the items by looking at what things actually do predict recidivism, right? Collect data and then look at that. So let's say I start with 200 questions or something like that. What I want to do is reduce the number of items by looking at what things correlate with each other. So if I add, let's say that, really in my Kraft mac and cheese example, if people really like to save time, but they don't really care about saving money, right? And they're not really related, I can't add those two things up and that score be meaningful. So what I want to do is I want to take away one of those questions. So I would then look at which one is actually relevant to the outcome that I'm interested in, and then reduce the factors that way. The extraction of factors is that in all of these risk assessments, they're measuring multiple things. So we call them domains sometimes. So we'll have like how many friends do they have who are involved in the criminal justice system, for example, like all of your social issues. And then you might have questions that are really around education, right? Their educational attainment and maybe their employment history or something like that. So those are separate factors, and you might use them differently based on how they are related to recidivism. Dimensionality is another kind of another word of looking to see mathematically whether those factors that we took out are actually contributing to that total score. So if we add up all of those scores, do they actually indicate your risk for recidivism? And then predictive validity is what that means is, does it actually predict recidivism? So if you have a total score, is it actually predicting whether or not somebody comes back to you? And then finally, reliability. This is one that that is always an open question, and it rarely gets answered in research. So if I were to have two people sit down during an interview looking at a risk assessment, and if I were to have two people scoring that interview, do they come up with the same scores? In some of these, especially the ORAS, for example, relies a lot on the interviewer's interpretation of the story, right? That there's a lot of subjective judgment that goes into the score. We actually tested the youth version of the ORAS on reliability, the OYAS, and we actually found pretty decent reliability, but there were a few questions, particularly around things like a youth's respect for authority and things like that, where interviewers were coming up with different answers. What you ultimately want is a tool where, regardless of who is doing the interview, they come up with the same conclusions. You don't want the context of the interview affecting whether somebody is moderate risk or high risk, and you don't want that affecting your decision around what treatment they should get, and ultimately whether they should be incarcerated or not, right? So decisions around that, you don't want that to be subjective. Next one, please. Next one. What did I just do? Sorry, I did something over here. There we go. Sorry about that. So the development of the ORAS. The initial tool included over 200 items. That is a lot of items. And it was a very, very, very long interview. I think the authors said it took around 2 hours, was the original ORAS. And what they did was they took those 200 items and they identified the items that best predicted recidivism. The ORAS, I think, is still a fairly long and comprehensive tool, but it's not as long as it could have been. They defined recidivism as new arrests, something that you'll kind of know if you look at criminology and research in criminology, is that recidivism is usually defined as arrests. And the reason is because you can't quite wait a year for folks to be going through the justice system and for convictions to happen. And we kind of run out of time and grant dollars to be able to study that. So oftentimes recidivism is defined as new arrests. So then when they were developing the scoring around the ORAS and defining what score gets a low risk, a moderate risk, and a high risk, they did this by examining the distribution of failure rates. What that means is that you're looking at the distribution of folks who are reoffending, right? Who are actually rearrested. And the idea here is that you want low risk folks to a very small percentage to be reoffending, moderate to be in the middle, and high to be fairly high. So when we look at the community supervision tool of the ORAS, the initial sample, about 59% of high-risk males were rearrested. 40% of high-risk females were rearrested. There, a long time ago, I did this presentation for a group of judges. I said, okay. I asked some folks what they thought the failure rates were for somebody who is high risk. And I got a huge range, but many of them were like, well, you know, if you're high risk, you should be around 80, 90%. It's not that. There's a lot of area for wrong predictions. So for high risk folks to not recidivate. So I think that's a thing to keep in mind when you're making decisions, especially around confinement. That high risk doesn't necessarily mean that they're absolutely going to be rearrested in the next year. It means that they're more likely than low risk folks. Next slide, please. Okay, so construct validity. This is a psychometric property. What construct validity means, it's how well an assessment measure measures what it is trying to measure. That's a lot of measure, but basically, does the risk score actually measure recidivism? So in RNR tools, they're trying to measure criminogenic risk and they're trying to measure criminogenic needs. So are they actually doing that? Right. What you want to look at is whether items and questions are related to one another. So are they, you know, if I say yes to one question, am I more likely to say yes to the next question? Right? If they're opposite of each other and I add them up, that's problematic, right? So because, you know, essentially if I'm adding scores and coming up with a total score, each of those items should be contributing to that total score. So I have this, like the picture of the gears over here. And the idea here is that they're all working together. So all of these items and all of these questions should be working together to be able to measure that ultimate construct, which is criminogenic risk. And if they're not doing that, then we have problematic questions in there. Next slide, please. Okay. And then predictive validity. This is an area that most tools have focused primarily on predictive validity and how well a score predicts the outcome of interest. And I'll kind of talk about why that's been problematic and why that's kind of the original sin later. But the idea here is that higher criminogenic risk equals more likely to recidivate. So if you have a higher score, then your likelihood to recidivate goes up. And that seems pretty intuitive. And typically, the most available research information is going to be around predictive validity. Most studies, most tools focus on predictive validity, and that's what they talk about. And it's generally seen as kind of a fundamental assumption, right? That like as your score goes up, then your likelihood of recidivism should go up. Okay, next one, please. So what's in a total score? When you do an ORAS or the CCAT, you get a score. A lot of times we call them algorithms. And I got to tell you, it's, the word algorithm is kind of cheap here because typically it's a sum score. That's really all we're doing is just summing up these things. It's not, this isn't like the Facebook algorithm. It's really not that complicated. And there are reasons for this. Especially when I was in Ohio, a lot of counties still used paper and pencil, right? And so you really couldn't introduce a really complex algorithm to score these things because a person with paper and pencil is doing this and trying to figure out the score, right? So you want this to be fairly simple and straightforward. The assumption for that total score is that all of those items are contributing towards a total score, and all of the domains, so all of your things like your friends and your education and your employment, all of those domains are actually adding together and contributing to that total score. And then that second assumption is that that total score is related to higher risk of recidivism, and you're more likely to recidivate. So each item contributes to a domain, and then each domain contributes to the total score. Next slide, please. All right. So the CCAT, that actually has a few domains in here. So you have employment, education, housing, social and familial networks, personal relationships, attitudes towards crime and violence, impulsivity, substance use, mental health, and trauma. And each of these domains are made up by questions, made up of questions that measure these things. And so if you think back to the Kraft mac and cheese example, all of these things are, they're latent variables, right? So you can't ask somebody, how's your trauma? Like on a scale of 0 to 10, what's your trauma? It's really, they're questions that are answer measurable, that are kind of contributing to the measurement of trauma. Right? And so all of these domains are these latent variables. Next one, please. So within the CCAT, so this is the CCAT. Inside the social and familial networks, you kind of see what I'm talking about here. Do you think your current use of free time leads to trouble with the law? Right. That is getting at this like social network issue, right? And you can see that within this, 2 points for yes extremely and 1 point for yes quite a bit. And the idea is that if I say extremely, I'm more likely to be, that's more likely to be contributing to a higher risk of criminogenic risk and higher risk of recidivism. Same thing as about how many of the people you spend time with on a regular basis who have served time in jail or prison. And you can see that, as you go up, the idea is that this question is contributing to the measurement of social and familial networks that may be criminogenic. And so as the score goes up, your likelihood for recidivism also goes up. Next, please. Okay, racial disparities. There's a lot of research to suggest there are racial disparities in risk assessment tools. The early research around racial disparities was to focus on the proportion of recidivists for each category. Right? The idea was that if your low-risk folks are recidivating at a lower rate than moderate and high, then that must be fine, right? And if this was true across racial groups, then we're good. The problem with this is that if you kind of think back to R&R theory, that if I were to misclassify somebody and you're actually low risk, but the assessment categorized you, misclassified you as a high risk individual, and you were put into a more intensive program because of this, then that just turns you into a high risk person, right? Because the R&R principle says that you have to match the risk of recidivism. You have to match treatment with your risk for recidivism. So misclassification is something that's really hard to see empirically because misclassification leads to higher risk, right? And then here again, that one of the problems here is that validation really focused on prediction. Criminal history is a really great predictor of future justice involvement. But the question is, does that really simply reflect systematic inequality? Were you more likely to be arrested because of the neighborhood you're living in, and the type of policing that happens in the neighborhood you're living in? Does that, and racial disparity around who gets arrested, is that really what's being measured here, right? So if criminal history is a great predictor of future justice involvement, that doesn't necessarily mean that's part of your behavior, right? And so there's been a lot of talk about simply removing criminal history as a factor in these risk tools. I don't think that actually solves the problem, but I'll get into that. So recent research, we're finding out a little bit more about this. At the domain level, so those larger domains that we look at, they're finding that criminal history predicted recidivism really well in white males, but not really anybody else. And then factor analysis examining total scores have not supported the use of a total score, so that when you add all of those things, your mental health and trauma and social and familial networks and criminal history, maybe that's not the best way that these tools can be used. And that's an open question that's still kind of being investigated in research. And then there's the item level issue. So in some of the research, you can see education, employment, and substance use items were higher in Indigenous versus non-Indigenous youths. This was a study in Canada of the LSI. And we actually found the same thing in the OES, in the youth version of the ORAS. What we found was that when you look at educational items, one of the educational items in the OES was, have you been suspended ever? Have you been suspended or expelled from school ever? Almost the entire sample, Black youths were almost the entire sample said yes to that question, that they were either suspended or expelled ever. And this really speaks to the use of suspension and exclusionary discipline in city schools, right? And this was mostly kids in Cleveland who kind of experienced this. So if you've got 90% of a sample saying yes to that question, is that question really relevant at all, right? All it's done really is just add to your score. And we're actually seeing quite a bit of racial differences on some of these scores, that there's a fairly good variability among white kids who, for a question around, do you have any friends who are justice involved? For white kids, there was quite a bit of variability. For Black youths, they were pretty, I mean, it was more around 70, 80% in terms of incidence of people saying yes. That's not very good, because what that does, again, is you're adding to the score and really making it less likely for a Black youth to be in the low category. Right? You're kind of artificially adding that. Because ultimately, if just about everybody is saying yes, all you did was describe juvenile justice involved youths. That's all you did, right? Not really separate out who is more likely to be rearrested and who is not. Next one, please. Okay, so the state of the research. So predictive accuracy, there's some evidence for accuracy across racial groups. This is the idea that if you're low, moderate, high, you're more likely to recidivate as you go up. Right? But it's fairly problematic, as I just discussed, that really if you're in the high group, that treatment and the intensity of the treatment is going to be affected, and it's going to make you more likely to recidivate. And then there's disparities in categories. So overall, we see that Black males are more frequently categorized as high risk. There's disparity in subscales, that those domains, those like education and mental health and trauma and social familial networks, those things may not be consistent across race, that the measurement of those domains may not be consistent. Disparity in items, that items are not endorsed at the same rate and may not indicate risk in the same way. This is the idea that, I was just saying how Black youths are way more likely to say they've had friends that are involved, who are involved in the justice system, or who, they're way more likely to say yes to whether they've been suspended or expelled from school. And then criminal history. Because of some of those structural issues around who gets arrested in this country and how policing is done in certain neighborhoods compared to others, criminal history does not predict recidivism accurately across racial groups. Ultimately, what we're trying to do with a risk assessment tool is you're trying to measure behavior, right? Whether you're likely to reoffend. And what I'm saying here is that reoffending, and rearrest are not exactly the same thing. So behavior does not equal arrest in the same way across racial groups. Next slide, please. Yep, there we go. Okay, so this is a Venn diagram of just to illustrate exactly what I'm talking about here. So peers and social networks, this in the OES, this is whether you have friends who are justice involved, whether you have friends who are involved in gangs and those types of things. So it's actually, there's a fair bit of overlap between recidivism, reoffending, and peers and social networks. Can you left click? Actually, just bring up the whole thing, yeah, and then we'll talk about it. Oh, nope. Thank you. Okay, so you can see that variability in recidivism is largely explained by race. So if we're measuring recidivism as whether you're likely to be arrested, race is going to predict a lot of that. And variability in peers and social networks is also explained by race, because if you're more likely to be arrested in your neighborhood, then your friends are too, right? So you're way more likely to know somebody who has been justice involved because of the differential rates of arrest across neighborhoods. So theoretically, there absolutely is a correlation between peers and social networks and recidivism. I don't think that's theoretically inaccurate. The problem is that it amounts to very little, because once you throw race into the equation, you'll see that kind of race overwhelms most of how much variability and recidivism is explained by peers and social networks. Because race explains both of those things, it really kind of swallows up most of the power of the peers and social networks variable in predicting recidivism. Next one, please. Okay, so this is from a study that I just recently completed on the OES, the Ohio Youth Assessment System. And what we did was look at predictive validity, but we looked at race. So what an AUC means is that what you want, essentially, something that's well above 0.5. What 0.5 essentially means is that it's essentially a coin flip, or is it's really not predicting recidivism beyond just the flip of a coin. If you're under a 0.5, that means that you're actually better at being wrong than you are at being right. So that's really bad. Generally, you can see for Black youths, they were kind of hovering around that 0.5 mark. So that really, for misdemeanors, felonies, all charges, this tool wasn't very good at predicting recidivism. But for white kids, they were actually a little bit better. What you want to achieve is around a 0.7, but to predict recidivism, these tools are hovering around the 0.6, mid 0.6 to 0.7 range. So the OES is actually about as good as any other tool at predicting recidivism for white kids. So what we're seeing here is that the OES total score is actually doing a much better job at predicting recidivism for white kids than it is for Black kids. Now, why is that? Well, like I said, a lot of these risk tools, what they're measuring is your behavior, right? Your likelihood for behavior. And what this might actually indicate is that for white kids, your behavior might be a decent indicator for whether you're going to be rearrested. For Black kids, it is not. it's essentially a coin flip. So if the OES is telling you that they're more likely to behave in a way that might be criminogenic, that's not actually reflective of whether they're going to be rearrested. Next one, please. Okay, so what do we do? Few recommendations for both research and practice. On the research side, we need a better understanding of how risk changes across time. So the big innovation here is that we're measuring dynamic risk, that things change, right? The problem is that we really only collect risk assessments once and then not follow up at all. So I don't know that it can or can't be a good tool in understanding whether criminogenic risk can change. I don't know, because I don't think I've seen a study that looks at multiple time points. And then we need to really raise the bar on the investigation of psychometric properties of these tools. So like, instead of just looking at whether it's predictive of recidivism, we need to kind of look at the item levels. We need to look at some of those problematic items that basically everybody says yes to. Things like whether they've been suspended from school ever. And then we need to kind of move beyond, that should say simple definitions, sorry about that. But simple definitions of recidivism. And I've had these conversations quite a bit about the way we measure recidivism as a yes or no, did they recidivate or not, sometimes is not an accurate picture of how well those treatment programs worked, or really success or failure in the justice system. That if somebody comes in with multiple violent felonies and then they're rearrested on a drug possession charge, that's a yes on the recidivism measure. But I would count that as a success. I really would. And so that's so research really should kind of try to come up with better ways of kind of measuring success and failure. And then finally, moving beyond recidivism, that ultimately, when we're talking about addressing criminogenic needs, and then we're simply measuring whether they're arrested or not, I don't know that that's a very good method of doing so. So if somebody's coming in with housing needs, right, or like trauma, 6 months later, whether they were arrested or not, I don't know is a very good measure of success or failure. That you really want to be able to measure whether these things are, whether risk assessments are doing a good job in measuring whether folks were pointed to the right types of treatment or not, or whether they're successful in treatment, whether their issues with trauma are lower today than they were 6 months before when you placed them in the program. And then in terms of practice, I think there needs to be better planning around how to integrate information from risk assessments to guide decisions. I think 10 years ago, when we were really pushing risk assessments, the idea was that this was the go-to piece of, yes, I will try to just stop talking in a second here. So I think there was a push to really kind of have this as the one thing that places people into treatment. What I've found through my research is that when you depend on risk assessments to guide treatment decisions, folks get kicked back to the courts. right? That they're not actually, they don't actually meet the minimum requirements for that treatment modality. And then kind of understanding the racial disparity issues that I just talked about, because honestly, research cannot fix those disparities because we really can't correct systematic inequality, right? That's no matter what, if we're measuring, if the homework is to measure whether somebody is going to reoffend, and we're doing this by arrests, there's no way to get around racial disparity, and you really kind of have to address this through policy. And that's the only way we're going to get around those racial disparity issues. And then kind of work through the trade-offs of using a risk assessment. All right, I'm going to stop so we can, any questions? I'm going to leave you with that, that quote. So one cannot expect any risk assessment tool to reverse centuries of racial injustice or gender inequality. That bar is far too high, but one can hope to do better.
Thank you so much, Fred. That was very informative, a lot of content. The slides will be shared. We will also share the recording, and I will send out that via email either later today or tomorrow for all of you. I did have a question in the comments, and I also see that Leah asked about questions. One specific question is, someone is scheduled to attend an ORAS training soon, and they ask, can you advise which CCAT or ORAS would sum a more accurate risk or needs score? And I will say in Washington State, I think there's a couple different CCATs in use. So we're starting with the softballs, Fred.
So basically, which one's better, the CCAT or the ORAS?
I think so, yes.
So I think the ORAS is much more widely studied than the CCAT, basically because the ORAS has been around a lot longer, and it's used in a lot of states. So I can criticize the ORAS quite a bit. But I don't necessarily think that either one is better or worse. The ORAS does require quite a bit of professional judgment, subjective judgment, and I suspect there's some issues around reliability there. So there would be some differences between those two raters, but I think they cover that quite well in the training. I do know those folks from the University of Cincinnati quite well, and so I think they do a great job of training. So it really depends on what you want in a tool. Do you want something that's more that involves more structured judgment than something that's more of a questionnaire? I think that's really the big difference between those two tools.
And then another question is based on the section that you talked about, racial disparities. Is it not? So the question is, are these tools not good whatsoever for Black youth? Is it better, in your opinion, to not use a tool? What would be the benefit of continuing to use the tools? I know that's best practice.
So I am a big proponent of the use of risk assessment tools, even given the racial disparity issues. The research out there suggests that the use of a tool reduces racial disparity compared to jurisdictions that do not. So basically relying on the subjective decision-making of judges alone. With that said, there is racial disparity in these tools as well. So just because something is developed with science in mind and data, that it's only as good as the data that we have. So there is going to be, you cannot kind of assume there's science and data behind it, so it must be objective, that there is racial disparity within these tools. My contention is that it's much better than just pure subjective decision making.
Thanks, Fred. I have questions. I had a question about, or actually you can see Alex put in the comments that she has a version, or they, actually don't know why, I assumed Alex to be any gender at all. So the version that Alex has doesn't have a scoring page for social and familial constructs and what the different versions look like. That leads into what I was going to say about what our next session will be next month. So next month is a drop-in session. However, we will have representatives from AOC and HCA to talk about what these tools look like in Washington State. So not necessarily presenting on that, but allowing for a drop-in to say, what do we see being used across the state? What kind of versions are out there? Hoping to be able to answer some of those more specific questions. And yes, Alex, thanks for clarifying your pronouns for us. So that being said, I don't know, Fred, if we have different versions of the CCAT available to share out.
I do not. I do have the CCAT modified, though, that does have the social and familial construct, so I can send that out, but I don't have all of the different versions of.
Okay, great. So if you send that to me, I can include that when I send everything else out too.
Okay.
Other questions from folks? Thank you all so much. We'll update and the flyer for next month, send that out as well, same link, but we'll be here. I believe it is also the 13th next month, March 13th. And again, we'll have an open session, so not necessarily a presentation, but time to be able to talk about these tools as they're used in Washington a little bit more. Thanks, Fred. Thanks, everyone.
Thank you.